paying from your pocket isn't the wisest choice. And even if you're insured, are you adequately covered? Check again. A cover of 10 lakhs for a family of 4 is as good as no cover, as you pay the premium, but when the hospital bill arises, it only covers a portion of the total expenses. But what if there was a single smart investment that could take care of your finances against all such medical emergencies? We have everything we need for a good life. From smart connections, smart gadgets to smart investments. We even secured our finances right. But none of us were really prepared for the storm called coronavirus. We all know that even though we might be doing monetarily well, this illness can cost us a fortune. It could also hurt the entire family together and multifold the expenses 4 times. On top of that, the medical inflation has flared up the costs of treatments, and we won't have an option but to abide by them. And because we prefer single or exclusive suites in well-known hospitals, the capping on room rent and consultation charges would further stress the medical bills. Not to forget how modern life has affected our strength to combat the new and upcoming variants of illnesses. In such trying times, paying from your pocket isn't the wisest choice. And even if you're insured, are you adequately covered? Check again. A cover of 10 lakhs for a family of 4 is as good as no cover, as you pay the premium, but when the hospital bill arises, it only covers a portion of the total expenses. But what if there was a single smart investment that could take care of your finances against all such medical emergencies? We have everything we need for a good life. From smart connections, smart gadgets to smart investments. We even secured our finances right. But none of us were really prepared for the storm called coronavirus. We all know that even though we might be doing monetarily well, this illness can cost us a fortune. It could also hurt the entire family together and multifold the expenses 4 times. On top of that, the medical inflation has flared up the costs of treatments, and we won't have an option but to abide by them. And because we prefer single or exclusive suites in well-known hospitals, the capping on room rent and consultation charges would further stress the medical bills. Not to forget how modern life has affected our strength to combat the new and upcoming variants of illnesses. In such trying times, paying from your pocket isn't the wisest choice. And even if you're insured, are you adequately covered? Check again. A cover of 10 lakhs for a family of 4 is as good as no cover, as you pay the premium, but when the hospital bill arises, it only covers a portion of the total expenses. But what if there was a single smart investment that could take care of your finances against all such medical emergencies? We have everything we need for a good life. From smart connections, smart gadgets to smart investments. We even secured our finances right. But none of us were really prepared for the storm called coronavirus. We all know that even though we might be doing monetarily well, this illness can cost us a fortune. It could also hurt the entire family together and multifold the expenses 4 times. On top of that, the medical inflation has flared up the costs of treatments, and we won't have an option but to abide by them. And because we prefer single or exclusive suites in well-known hospitals, the capping on room rent and consultation charges would further stress the medical bills. Not to forget how modern life has affected our strength to combat the new and upcoming variants of illnesses. In such trying times, paying from your pocket isn't the wisest choice. And even if you're insured, Are you adequately covered? Check again. A cover of 10 lakhs for a family of 4 is as good as no cover, as you pay the premium, but when the hospital bill arises, it only covers a portion of the total expenses. But what if there was a single smart investment that could take care of your finances against all such medical emergencies? We have everything we need for a good life, from smart connections, smart gadgets to smart investments. We even secured our finances right, but none of us were really prepared for the storm called coronavirus. We all know that even though we might be doing monetarily well, this illness can cost us a fortune. It could also hurt the entire family together and multifold the expenses 4 times. On top of that, the medical inflation has flared up the costs of treatments, and we won't have an option but to abide by them. And because we prefer single or exclusive suites in well-known hospitals, the capping on room rent and consultation charges would further stress the medical bills. Not to forget how modern life has affected our strength to combat the new and upcoming variants of illnesses. In such trying times, paying from your pocket isn't the wisest choice. And even if you're insured, are you adequately covered? Check again. A cover of 10 lakhs for a family of 4 is as good as no cover, as you pay the premium, but when the hospital bill arises, it only covers a portion of the total expenses. But what if there was a single smart investment that could take care of your finances against all such medical emergencies? We have everything we need for a good life, from smart connections, smart gadgets to smart investments. We even secured our finances right. But none of us were really prepared for the storm called coronavirus. We all know that even though we might be doing monetarily well, this illness can cost us a fortune. It could also hurt the entire family together and multifold the expenses 4 times. On top of that, the medical inflation has flared up the costs of treatments, and we won't have an option but to abide by them. And because we prefer single or exclusive suites in well-known hospitals, the capping on room rent and consultation charges would further stress the medical bills. Not to forget how modern life has affected our strength to combat the new and upcoming variants of illnesses. In such trying times, paying from your pocket isn't the wisest choice. And even if you're insured, are you adequately covered? Check again. A cover of 10 lakhs for a family of 4 is as good as no cover, as you pay the premium, but when the hospital bill arises, it only covers a portion of the total expenses. But what if there was a single smart investment that could take care of your finances against all such medical emergencies? We have everything we need for a good life, from smart connections, smart gadgets to smart investments. We even secured our finances right, but none of us were really prepared for the storm called coronavirus. We all know that even though we might be doing monetarily well, this illness can cost us a fortune. It could also hurt the entire family together and multifold the expenses 4 times. On top of that, the medical inflation has flared up the costs of treatments, and we won't have an option but to abide by them. And because we prefer single or exclusive suites in well-known hospitals, the capping on room rent and consultation charges would further stress the medical bills. Not to forget how modern life has affected our strength to combat the new and upcoming variants of illnesses. In such trying times, paying from your pocket isn't the wisest choice. And even if you're insured, are you adequately covered? Check again. A cover of 10 lakhs for a family of 4 is
A very good evening, everyone, and a very warm welcome to all of you. Hope you all are safe and doing well. Thank you for joining us today as we celebrate a 4-year partnership between Yes Bank and Reliance General Insurance. A partnership keeping true to our promise of committing to the agenda of securing health. I'm extremely happy to welcome you all to the webinar Health Matters, Health in COVID Times, curated exclusively for you. My name is Khyati Kawa and I will be your host for today. Today, we all live in an uncertain world and have numerous questions in our minds on how should we protect ourselves and the health of our family members while securing a financial backup during these times that are testing and volatile. With the third wave of the pandemic in the hindsight, the ever-increasing medical costs due to inflation, the induced stress and uncertainty about the current situations lead us to face a lot of mental and financial pressure. Would it not be great at this juncture to understand how to keep ourselves afloat and take care of the well-being of ourselves and our family? Understand what kind of precautionary steps one should take to keep oneself fit during COVID, post-COVID, and how a comprehensive health insurance is the most important thing in current times. Now that will take care of you till infinity. Well, that's exactly what we have in store for all of you today. The Yes Bank and the Reliance General Insurance team has planned this webinar to help secure and take care of all your medical and financial burdens. Ladies and gentlemen, today we will be talking about combating COVID-19, the new strains, the after effects, the vaccines, and any questions that you might have. Before we begin, I would like to inform you all that during the entire course of the webinar, you can send in your questions and feedback to us via the Q&A feature that is visible on your screens. Do add in your location and then your questions so that your experts, our experts right here can address them. I hope all of you are ready and set and all of you are safe in the confinement of your homes or offices. I'd like to welcome once again to all of you at this Health Matters webinar. Now, without further ado, I would like to welcome our special guest for today. I hope all of you are ready to join me in welcoming Dr. Rahul Pandit. Dr. Rahul Pandit is a senior intensive care consultant with over 2 decades of experience and is the director of critical care medicine and ICU at Fortis Hospital, Mumbai. Dr. Rahul Pandit plays the lead role in setting up ICU policies, protocols, and patient care algorithms. He is the Vice President of Indian Society of Critical Care Medicine and visiting consultant at Bathurst and Wagga Wagga-based hospitals, New South Wales, Australia. He's also a member of the National Task Force appointed by the Supreme Court of India and a member of Maharashtra Government Task Force for COVID-19. This task force played a key role in establishing a patient management protocol for serious and critically ill patients. Ladies and gentlemen, let's welcome Dr. Rahul Pandit on the screen. A very warm welcome to you.
Thank you very much. Thanks for the introduction, Kathy.
Thank you so much. We are privileged to have you here, Dr. Pandit, and having you on the task force, who could be a better person to answer all our questions that goes around for all our viewers as well. So firstly, once again, welcome to you.
Thank you. Look forward for the interaction.
So Dr. Pandit, tell us, everyone right now is talking about the Delta Plus variant. Ministry of Health and Family Welfare has termed it as a variant of concern. Now, what does this mean for any layman right here? And should we be worried?
I think that's a very important question. Most of the webinars or any information which sort of goes across in COVID-19 right now, everybody is interested in the Delta Plus variant. So let's understand what are these variants first. So just like we change our clothes, the viruses change their structure so that they are able to protect themselves well from being destroyed. So what a virus does typically is when it enters into a body, it creates a copies of itself. And we measure those copies, and that's what we actually call how many viral copies does this person have in infection. And during these photocopies being made of its virus, there is some defect at one point. And then that defect gets copied on. And that's how you get a change or a mutation in that. And when that defect happens at a point where there is a receptor binding protein on the virus, which means that the area which the virus has attaches to the ACE2 receptors in our body, when that change or that defect happens in that area, it becomes a variant of interest or a variant of concern. Okay. So when it is variant of interest means, yes, this has got a potential to either be more infectious or more lethal. Whereas variant of concern becomes that, yes, it's a more lethal or a different virus which can actually have more transmissibility or more infectivity. And we need to be very, very careful about it so that this does not become the new variant which is spreading across. And that's why the government has actually termed this as a variant of concern in their news bulletins or the news reading, the data outputs which they keep on giving every evening. The Delta Plus is a concern. But let me just assure all of the readers that first, the Delta variant itself actually is very, very infectious. And right now, it is the most prevalent variant across the world, with many countries having almost 100% infection caused by this variant. So you should not be worried about Delta Plus. We are already dealing with a very, very infectious variant anyways. And for a common man, as long as they do the masking properly, social distancing properly, and take the vaccine when their turn comes, the variant should not bother them, because these three things will actually protect them from any variant, any subsequent variants as well. What these variants are for us doctors, for epidemiologists, for government officials to basically formulate epidemiological policies, isolation policies, vaccination policies, so on and so forth. For a common man, it should not bother at all.
Absolutely. Thank you for that insight. I think that really clarifies that it's a variant for the authorities and the medical professionals to take a precautionary measure and create more policies around it for further discussions. But because Dr. Pandit, you spoke about the vaccine here, so would the existing vaccines be effective in protecting against the new variants and mutants? Now, this is a question that bothers most of us, that if the new variants are coming up, should this vaccine be effective?
It bothers me as well, trust me, because we are healthcare workers, we are frontline workers. We keep on going and seeing patients actually in the ICUs, in the wards. So that's something which we are concerned as well. And I will tell you, let me assure everyone right now that the vaccines which are currently available in India and authorized in India are completely safe and are going to cover and protect us from all variants. Now, am I just bluffing here? No, I'm not. I will give you a very recent paper published on 27th of July, sorry. This is 1.5 million people, 15 lakh people from the Indian Army. Indian Army is almost having a vaccination of almost 98% of their personnel who are there in the Indian Army. They were obviously frontline workers, so they got the jab along with us. All of them got Covishield. Okay. And then they did a effectiveness study of the Covishield where they looked at around 1.3 million people out of those. And they found that the vaccine was protective in 93% of the people from protecting them from COVID-19 subsequent infections. 2% of the people did get, 7% of the people did get a COVID-19 infection, but they were mild or asymptomatic. Out of 13 lakh people, 2% people required admission. That's it. And there were only 7 deaths out of 13 lakh. So I don't even know the mathematics. I'm weak in math. That's why I'm in medicine. But you can, the bankers here can calculate the percentage, but I think it would be somewhere between 0.005 or something percent, or maybe even less mortality than that. So we are looking at an extremely safe environment for us to work and to live in, provided we are vaccinated and provided we follow the rules. So what's important to understand is even after vaccination, mask doesn't go away. And let me tell you right now in all itself for all your audience, and I might probably repeat this again and don't think it's repetitive. Mask is with us till 31st of December 2022. Don't even think of it that you are going to live without a mask. After 2022, I don't know. I don't have a crystal ball. But from an epidemiological point of view, after you vaccinated the entire population, you should still continue with all the measures for at least 1 year. So we have a target of vaccinating everyone by this December. So another 1 year to go across before we can say that maybe the mask may disappear. Maybe. That's a big question mark. Nobody knows. But till 31st of December 2022, we have to keep on wearing the mask.
Wonderful. Now, such a relevant point that you've made, because we all kind of get into this perception that if we're vaccinated, we don't need to, take care of any precautionary measures, or we can go around easily because we are vaccinated. We have the immunity to fight the COVID. But thank you for bringing that point forward. With that in mind, I wanted to ask you, Dr. Pandit, that with offices and workplaces resuming now across the country, what measures should employers take to ensure safety of their employees?
I think, again, a very, very important question. So let me put it this way. For those businesses or offices or whatever workplace you have, if you can continue to have work from home and still be able to have the same productivity and same business which you would normally have if it was work in person, then these people should continue to work from home. That's the safest thing for the employer and the employee. There is no second doubt about that. Okay, but obviously there are several businesses which need people to walk in and to come in. So in those places, I think if you can manage with 50% work from home, 50% from work in place, then I think you will have a reasonable via media or a sweet spot to have everything going on. But there are emergency services like banks, where like government offices, where you require a full attendance. In that case, I think whatever office infrastructure you have, you probably need to realign a bit so that at least there is 2 hands distance between the 2 people who are sitting. Lunches have to be allowed at their own desk, not in the canteen area, if at all you can have. If at all you are having it in the canteen area or a cafeteria area, then the distancing should be same as what I just described between the 2 people who are sitting. Third thing, ensure that masking is there all the time. Fourth thing, that vaccination is compulsory. At least 1 dose of vaccine should be given to all people.
Right.
Fifth thing, if you can have staggered timings. I always say, and I've sort of said this to the government as well, that what stops us from starting the office at 6 a.m. and continuing till 10 p.m. And then we could have shifts which could start at 6, next shift could start at 8, third shift could start at 10, the next could start at 12. And then obviously after 8 hours, their shifts get over and they could go home. Many of us will be able to function that way. We are functioning that way in the hospital. And that allows you to have a reasonable full house. It also helps the government that the traffic, which is sort of heading to the office or heading back home, automatically gets dispersed over 3-4 hours. And you don't have a lot of crowding in the trains and buses. And that would allow the government to take up decisions to actually, allow the public transport to be in full swing as well. Right now, that's one of the things which is hampering, especially in cities like Mumbai, metros like Mumbai or Delhi or Bangalore, wherever we are in a big city. That's one of the big problems, that people are traveling in public transport, but the public transports are not open. So these are some of the things which you could do. I'm sorry if I'm overstepping on my time here a little bit.
No, absolutely not, Dr. Pandit. And it just kind of gives us a gist of that each organization needs to think and evaluate on basis of their requirements to be able to customize a system that works best for their employees, taking in consideration all the protocols that we have from the government coming in, and making safety as the center of their strategy that time. So thank you so much, Dr. Pandit here. Another quick question I want to ask you about, because now travel has opened, business travel especially has opened up, businessmen are moving around the country for business as well. So what measures here can they take to ensure safety during business travel?
Right. So business travel has to be, so people who are actually traveling out, I would say that definitely they should be vaccinated fully. They should have their 2 doses of vaccine completed and have at least 15 days gone by after the second dose. Now, the question would be which vaccine? Any vaccine which is available and approved by the government of India, please go ahead and take that. That will allow you a free vaccination passage using your Arogya Setu app, whether you travel by train or you travel by plane. The government has made that facility very easily accessible now. You can just put it on your phone and you can, it's like a currency now. People used to call it as vaccine as a passport. I call it as a vaccine as a currency. Whether you go in the hotel, you're going to need to show that. You go into a mall, you're going to need to show that. So it's almost like currency now. The second thing is that the businessmen should realize that they're still working for the day. So the mask needs to remain on all the time. One of the funny things which I find with businesses and businessmen is while we are entering the plane, as soon as we enter the airport, you go through a checking, you go through long queues, you enter the plane, you wear that PPE kit if you're sitting in the middle row. But as soon as the plane takes off, the masks are out because everybody wants to eat. Avoid that. The mask should not be out in a plane. Mask should actually be double wear. Double mask should be worn all the time when you're stepping out of the house. So I am one of the persons who has actually advocated from February this year onwards that please wear a double mask. One cloth mask and one surgical mask is fine, or one N95 mask is fine. So if you're wearing a cloth mask, a surgical mask on top of that. Why double mask? Not only does it allow you to have an extra protection on your nose and face, but it also seals, the outer mask also seals all the gaps which the inner mask would be sort of leaving out. See, all of us have a different face structure. One size does not fit all. So we all tend to have gaps on our face depending on how our structure is. So the second mask actually helps you to plug those gaps, and that way offers you a better protection. So please, 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 if you're stepping out of the house for business or for anything, wear a mask. Last but not the least, when the businessman comes home or goes to a hotel in the other city to spend overnight, first thing, go in, have a shower, then go out and wear a fresh set of clothes and meet your family or get to your business in the office wherever you are. Because when you are out, you are exposing yourself. So protecting yourself is your business. Similarly, protecting our loved one is our business as well. So when you're coming home, shower and then meet your family members.
So true. And thank you. I think all those who travel around in trains or planes, make sure that you take care of all the safety precautions, not only just while checking in and entering, but also during the travel. It's really important for short flights, especially, to not take the mask off for the meal. I think that's a good note to take. Also, Dr. Pandit, now that we have seen COVID pandemic for more than a year, could you tell us if COVID has any residual impact on an individual's health?
Oh, yes, there is something called the long COVID. And in fact, last year, August, we were one of the first hospitals to actually start a post-COVID OPD, outpatient department. Okay. And the reason for that is that there are several patients who have subtle symptoms and signs who probably don't realize that in a very clear way. And then there are small number of people, small percentage of people who actually have very disturbing signs and symptoms, who seek help actively. So here I would like to give you my example, not a very good way to give an example, but unfortunately I do have an example of myself to give. So I had a COVID in month of May last year. And trust me, Kathy, the sleep pattern which I had before I had COVID and the sleep pattern, same sleep pattern to come back, it took me December 2020. I did not have good sleep for almost 6-7 months. And I am a person who gets on an average 3 to 4 phone calls every night. That's been there for last 2 decades almost. It's something which I've got used to. You pick up a phone, you talk to the doctor on the other end of the phone, give them instructions, go back to bed. Okay. That's something which was very natural. But the sleep was completely different. The sleep pattern post-COVID was very, very different. I would not fall asleep. If I got a phone call, I would probably take a long time to go back to sleep. And that's how it was almost a disturbed sleep for 6 months. One fine day, December onwards, it all sort of came back to normal. It sort of reset itself. So that's one of the commonest things, fatigue, sleep disturbances, changing their eating pattern, bowel disturbances, fear, nightmares. And then there is a lot of mental health issue, which many of them have not realized, especially those who have lost their jobs or lost their loved ones, have had through a very difficult financial situation, or maybe spent a lot of time in the hospital, or they were in the ICU or something where there was a near death experience for them. All of those people have got a lot of problems, almost to the tune of post-traumatic stress disorder, I would say. And they are not seeking help. We need to actively encourage them to seek help. So in the office, if your colleague is looking a bit different and you know that they have gone through COVID or their family has gone through COVID, be approachable to them, speak with them, ask them to seek help. It's curable, it's treatable, and there should be no stigma associated with that. It's something which they will come out of it quickly. They just need to speak to the right people. That's all.
Absolutely. So true, Dr. Pandit. And thank you for bringing mental health to the forefront as well, because while we deal with the physical health symptoms and, take care of our health physically, I think mentally, a lot of our viewers who are watching, families, friends have gone through this traumatic incident especially during the second wave. That brings me to this question, Dr. Pandit. The second wave of COVID saw the need of oxygen concentrators. And can oxygen concentrators be installed in housing societies, corporate offices, etc., to curb this shortage when there is an emergency?
So let's answer this question in a different way.
Sure.
I know for sure that government has now made adequate efforts to make sure that the oxygen requirement, which went up during the second wave, God forbid we have a third wave which is as bad as the second wave, then they will be able to actually supply the oxygen required. I would be very, very clear. I want to be very clear on that.
Yes.
But having said that, last year itself, in the month of April, I actually sent a write-up which many newspapers had picked up. There is no harm in having a sick, how this schools or colleges have a sick room or a sick bay where there's a nurse and children go there and they spend some time. I think most of our housing societies have got a gym or a office or some place which can be converted to that kind of a thing. And that's not a treatment room. I don't want it to be called as a treatment room. That's just a makeshift room till the point that a hospital bed is arranged for the person. So if there is a person who's got symptoms or who actually has tested positive in having breathing difficulty, they should be brought to that sick room. There should be a dedicated couple of members from the society who should be responsible for that sick room. You can keep an oxygen concentrator, a pulse oximeter, a thermometer, a simple paracetamol tablet in that room. As soon as the person goes in, effort should be made to start getting a bed for this person. But while that's happening, give him 2 to 5 liters of oxygen so that at least they reach in the hospital with adequate oxygen on board already and not deprived of oxygen for several hours. Because sometimes the bed can take, even if the bed is available, let's be very honest, it takes a couple of hours before you actually land on a hospital bed. Even if you're given a bed straight away, it's not like within 2 minutes you're going to be on the bed. So if your oxygen is dropping now, that 2 hours is a long time, an hour is a long time, 20 minutes is a long time. Whereas you just go down a couple of floors in your building and get on oxygen and let the ambulance come and pick you up. And that should be the only purpose of it. It should not be that abhi 2 din idhar hi rukte hai, let's just wait for here for 2 days and we'll get better. That's not the purpose of that room. So offices can have such a bay, housing societies can have such a bay, hotels can have such a bay. I think easily we can have these type of rooms, and that will also a safe thing because then you know which area to be absolutely certain to wear a double mask and go. Nobody would then be worried about it. So you can actually have the isolation area very well demarcated in the society, in the office, in the hotels or wherever.
Absolutely. That's a wonderful idea for, housing societies, huge corporate offices, and in fact, even hospitals themselves to have a sick bay for their staff as well in case there is an emergency case like that. So wonderful idea. Thank you. I have another question, which is around vaccination, because we're talking about vaccination as well in this conversation. That will vaccinating younger age group between 12 to 18 years become the driving force for reinforcing normalcy by aiding them to attend academics normally? They all are suffering quite a lot, the young lots.
Look, I think we are on the tip of the iceberg. We are the privileged lot where our children are able to actually get education via internet on phone. There is a larger population who cannot afford that, unfortunately. But at least for them, we should have the vaccination so that they can attend school in person. Not many of them can actually have a smartphone and internet connection or money to actually spend on that kind of a thing. I think for at least those children, we need to vaccinate and we need to start school in person. I really feel for them. I really feel that we all should actually collect all our handsets which are not in use and actually gift it to some people, underprivileged children who require it, and maybe pay for their internet for a month or two. It's usually very cheap, less than 100, 200 rupees a month, and they can get education. So I think we are the privileged one, and we need to think about that in a bigger sense. So answer to your question is yes.
Yes, right. So, Dr. Pandit, I would like to just take this opportunity to also inform all our viewers that there are facilities, organizations, NGOs who are working towards bringing these internet education to the lower strata of the society. So, if you'd like to go ahead and check them, just find them online and you will be able to see what you can do personally to help those kids. And, talking about kids, Dr. Pandit, there are many in our vicinity that we interact on day-to-day basis, kids, adults who are suffering because they cannot go out and study in a social environment, which is very, very important in developing them as young adults. So I wanted to ask you, what is the impact on mental health, both for adults as well as children, of this situation, this pandemic that we all are going through?
It's huge, Kathy. It's huge. So people who have not stepped out of their house for months together, children who have not been able to have a normal life, go out and play with their friends, not being able to make friends, I think they will actually lose their social skills. All of us have developed our social skills while playing with our friends, whether it was in the playground, whether it was indoor, whether it was on the terrace of the society, whatever. I think the social skills, the way we interacted, the way we are a person today, a lot of it was to do with how we interacted with our friends when we were kids. And I think it's important that it has to be recognized as a big problem, and there needs to be a counseling for these kids. Unfortunately, we are still not out of the pandemic, though there are kids now which I do see playing on the in the playgrounds and stuff, but not everybody is doing it. There are still a lot of parents who are being protective about their kids, and quite rightly so. I'm not critical here at all. I'm just saying the reality.
Yes.
I am protective about my kids as well. So we need to understand that they may be going through a very difficult phase. And in fact, when the schools open, it might actually be even more difficult for them. Suddenly they have to interact with people which they were not doing for a year and a half. So especially those people who have children who have migrated from school to a college,
Yes.
I think they are going to find it very difficult, because college is a whole different, and college or university is a whole different level of interaction altogether. And if they spend the first year just on the net, the second year is going to be very difficult when they actually start meeting each other.
Absolutely. So true, Dr. Pandit. And I can say from my own examples, my nephew is 6.5 years old. He's still now struggling to share toys because he's not used to going out and playing with other kids. And so it's a very difficult time, whether it is for toddlers, kids like of that age group, or whether we're talking about teenagers who still haven't gone to a physical college for the very first time and get that exposure that they truly deserve to be social beings in this environment. Thank you so much, Dr. Pandit. I would like you to stay with me right here while I welcome our other two experts on the panel. And if I want to tell all our audience, if you have any questions for Dr. Pandit or the two experts who are joining us shortly, send it to us in the Q&A tab right away. So I'm sure all of you, a lot of doubts have been cleared, a lot of worries have been put to rest. Now, before we dive deeper into the discussion, I would like to invite on screen two very important individuals from the top management of Yes Bank and Reliance General Insurance. Join me in welcoming Mr. Sanjeev Roy, Country Head, Third Party Distribution, Yes Bank. Mr. Roy is a proficient insurance professional with a rich experience in insurance distribution, MSME, lending, IT, and FMCG. His 21 years of experience spread across various financial institutions, such as ICICI Prudential Life Insurance, Electronica Finance Limited, Bharti AXA Life Insurance, in key roles with an emphasis on building strategy, opportunity, tapping and leveraging business development, and managing corporate relationships. At Yes Bank, Mr. Roy spearheads the third-party distribution with a fundamental philosophy of helping our customers to stay protected. A very warm welcome to you, sir.
Thank you, Kathy.
I would also like to take this opportunity and welcome here Mr. Anand Singhi, CDO, Reliance General Insurance. Anand Singhi is Chief Distribution Officer at Reliance General Insurance, a chartered accountant by qualification. Anand carries a rich experience of close to 20 years in management and leadership roles in the insurance industry. His strong interpersonal skills and robust work ethics has assisted him in emerging as an effective and dynamic business leader. Mr. Singhi started his journey with ICICI Lombard General Insurance Company in 2002 and played a critical role in strategically leading the product, underwriting, and claims functions for over 10 years with the organization. And now, with his decade-long stint with Reliance, Anand has been instrumental in setting up key business functions across sales and service verticals for the company. A very warm welcome to you, Mr. Singhi.
Good evening, everyone, and thank you, Kathy. Looking forward for our discussion.
Absolutely. So once again, very warm welcome to you, gentlemen. And I'm going to start with few questions targeted at all three of you at different times, and hoping that our conversation gives out a great value to all our viewers who are watching us. So, Mr. Roy, I want to start with you, asking you about how was the first wave of COVID different from the experience of the second wave? How did it impact the customers financially?
Thank you, Kathy, for the introduction, and welcome to all our customers who have logged into this webinar. I was listening very intently to Dr. Pandit's ideas and suggestions. I think a lot of unprecedented times, unprecedented worries. I think we'll be one generation which will probably write history in terms of going through something like this, which we never ever imagined. We watched in movies to an extent. Now, when the first wave hit, it was virtually something that seemed like a chapter from a horror story. Suddenly, a place like Mumbai, where I've been for ages now, and there was nobody on the road. Unbelievable scenes. Suddenly, people started finding nice things to say, saying there are more birds coming into the city now because people were not there in the city in the roads. Work from home, WFH, I don't think this term was ever so popular. At least I did not know about this term till about a year and a half back. People going the kind of packages and the kind of different kind of advertising that started happening to the healthcare industry from the hospitals, etc. That kind of became a new news. A lot of stories we heard about people going through the trauma of even when they were surviving, even when they were coming out of hospital, the bill amounts, the amount of money that they had to kind of sell out just to be there, which nobody had planned, honestly. Normally, you think that if you are 30, 40 and you are hearty and healthy, why would you ever need something like to cover yourself to a health insurance policy? And hence in India, our average sum assured, which is the amount of cover that typically an individual has, is around 3 to 3.5, 4 lakhs for people who are covered, and more than 50% population is not even covered. I'm talking to the set of customers who have logged in today. Most of them would be covered, I guess. But most of them, my guess is again that they would probably need to relook at the entire cover given this pandemic, because the kind of expenses that have to be incurred just to get out and become safer and become healthier has shot through the roof vis-a-vis the health insurance sum assured. A lot of customers we saw had to break because of this reason, break their fixed deposits, their savings, some of them had to take PLs, personal loans, just to be surviving, and coupled with this whole fact that their incomes had gone down. Whereas if you are a self-employed person, God forbid if you are a salaried person and your income has gone down or you've lost your job, there were not just emotional stress, but there are a lot of financial stress that we saw at individuals and families level when during the last 1.5 years time. I was waiting for Dr. Pandit to say that it will get over very, very soon. But as he rightly said, that nobody has a crystal ball here to kind of really predict the end of it. But I'm really hoping that this will be a lesson that all of us will learn and ensure that we are not just for the pandemic, that we are overall taking better care of our finances, our insurance needs, along with while taking care of our health. Of course, you'll have to take care of your health. But this pandemic has just told you that however much you may be healthy or you may be fit, you may be rich, you may be poor, there is absolutely no discrimination when it comes to attacking. How you cope up with it depends a lot on your immunity system and your ability to plan your finances. So, sorry for the long winding answer, but the two waves have given a lot of learning for me. I keep talking about it to our customers, to our colleagues, to my own team members, to my family members, to my extended family. I think it's a good thing. Unfortunately, as Indians, we typically suffer from this, Gajni type of syndrome, where when a situation happens, we all get worried and we all remember it. And when the moment that cloud goes away, we suddenly tend to kind of keep it in the back burner and forget it, which is what I think is the biggest message that we all should take, that we'll not forget the learnings from this entire last 1 month.
Absolutely. So well said, Mr. Roy. And we cannot agree more when we talk about that while we take care of our health and family, we must also take care of our financial health. Whether we are being financially sound, we have created a financial discipline for ourselves so that we can combat such an experience if ever it occurs again. Thank you so much for that. I'd like to move on and ask Mr. Singhi this next question. How do we determine an adequate health insurance cover for self and family? This is a big question that I think I personally also would want to know about. That what is that adequate health sum that we should take for ourselves or family? How much is enough? If you could just throw some light on that.
Yeah, Kathy. I think, first of all, I think Dr. Pandit and Mr. Roy, I think they have extremely significantly kind of really put out the criticality for discipline. Discipline both in context to how we should kind of really treat ourselves, how we should kind of behave ourselves during these times, as well as the financial discipline which is required to be kind of handled through. Having, one thing which we all need to understand that COVID still might happen to people who are vaccinated. COVID still might happen to people who are working from home. COVID still might happen to people in spite of taking all the precautions, right? But these precautions obviously will help us stay more healthy. But if we don't take care of financial protection, that's an error. That's a mistake which we are making by self. What has happened during these times is, given the fact that there was significant amount of media coverage, I think people have realized the criticality of having good financial discipline. And that's how people, we have really seen a significant uptick in terms of people going for health insurance as a critical tool for financial protection. But your question is dot on, Kathy, in terms of what should I kind of really buy in terms of sum insured, what should be adequacy of my health insurance. Right. This is where I think if you were to give a very standard response in terms of that, if everyone was to understand what is the bare minimum value, I think the thumb rule says that at least a bare minimum 50% of your annual income or a cost of a high-end surgery treatment. Say, for instance, if you need to go for a bypass surgery, that should be a bare minimum value which one should kind of really cover himself or herself for. Which, if you were to kind of really take it a couple of years back, typically people would end up saying that between 3 lakhs to 5 lakh rupees of sum insured is what we should buy. And if we have covered our whole family together in one set of policy, then we are good. Having said that, what we have really seen during these sort of times is, number one, the frequency at which you are needing treatment and support or medical attention has increased significantly as compared to the near past, number one. Number two, the severities also are significantly changing. As the COVID has kind of set in, the infection waves, people are starting to understand that. And we have seen cases in terms of value of hospitalization bill going from even a 2 lakh rupees for a COVID bill to an extreme of going upwards of 20 lakh rupees. So in the sense, it again kind of really resets the question that what is an adequate health insurance need? In my opinion, personal opinion, looking across at the recent set of trends, plus with some of the other factors which are critical when you decide for your policy. For an example, how many people do you really want to cover? Are you covering yourself or are you covering your family members? Do you have an existing ailment? Do you have an existing pre-existing disease, right? And how will the health insurance, how will the medical cost kind of really move forward 3 to 4 years from now? I think looking across at all these sort of factors today, we would kind of really recommend that any individual should take a bare minimum 10 lakh rupees of sum insured. That's our recommendation. And when we have kind of really used algorithms to see if there is a financial assistance required, a 10 lakh rupee insurance for an individual, does it take care of a good amount of severities and various probabilities? I think 99% of the plus of the cases will get taken care of. So our recommendation would be that while we will have to kind of evaluate everything from a point of how many people you are covering, whether you have got pre-ailments, what is the category of treatment you might require in future, how will the medical inflation move across. But every individual should have a bare minimum 10 lakh rupees worth of health insurance as a bare minimum.
As a bare minimum. That's a good ballpark figure for everybody to know that in case you're confused, this is the number that you must look at as a bare minimum requirement in today's times if there is any emergency for your health. Thank you so much, Mr. Singhi. Dr. Pandit, I want to ask you, just a follow-up question on what we have been discussing. Now, the experts are anticipating the third wave, coming and hitting us hard. What are your views on this, and how can an individual secure their health, even financially so?
Kathy, is it okay? And Anandji, is it okay if I just add on to your 10 lakh figure a little bit? Is that okay?
Yeah, absolutely.
Sorry, don't mind to undermine what you said. What you said is absolutely right. But for people who can afford to have a higher health insurance, I think they should go for higher figures. That's how I would put it. Because there are so many new things now which we are doing. Just looking at the pandemic in the last few, maybe 18 months or so, there are treatments which are probably still not covered by many insurance companies right now. And it's probably just that they are sort of been maturing out to understand what these treatments are for, and they would be covered up soon. For example, something which we do in ICU called as ECMO, extracorporeal membrane oxygenator. That therapy itself would cost between 5 to 10 lakh rupees, higher than a bypass surgery. And it's a bedside procedure which we do. Okay, because all the disposables are expensive. The circuit itself is very, very expensive. And then once you put the patient on that circuit, we actually continue on that circuit for a couple of weeks at least, those kind of things. So I think you can even go to 20, 25, 30 lakhs. It would be useful once in a while for you. I think that would be a very, very unfortunate thing, but then at least financially you will be protected on that particular time. That's the way I look at. In terms of your question that what can I add on to this? I think the third wave, I believe the third wave will come, and it will come shortly. It is not going to be far away. I think it will probably come in the month of September or October is what most mathematicians are talking about. I am, as a clinician, I can't make out any of that. All I can say that the virus is meant to come back again and again. So third wave will be there. Whether it comes in September or December, those are the predictive models which mathematicians work out on. But from the medical point of view, I think we may probably see increased infections, but less hospitalizations. That's how I look at it. So you can see what is happening in UK right now. UK is clocking between 25 to 40,000 cases per day right now, which are being diagnosed. But the hospitalizations have not increased and the deaths have not increased at all. So the purpose of vaccination and the purpose of having some antibodies on board actually is to avoid you getting infected first. But if you do get infected, then you don't actually land up in a hospital or you don't die. So the last 2 points are very important. You don't go to a hospital and you don't succumb to it. The first point, as Mr. Anand and Mr. Sanjeev both said, that you may still get an infection after having COVID or after having vaccine, but that would probably be mild or asymptomatic infection. So I would say that third wave, or not only third wave, there may be a fourth wave as well. Unless and until the entire population gets vaccinated, maybe once or twice completely, that's when we probably could think of the COVID virus going down and becoming endemic, like what we have H1N1 swine flu right now. So we are seeing swine flu in pockets in the country in particular season. You will probably see COVID-19 in pockets in a particular season as years come by. It will die down from a pandemic to become endemic in certain areas and probably vanish in certain areas on the earth. So we just don't know which areas would be the lucky ones and which would be the ones where it will become endemic.
Thank you. Thank you so much, Dr. Pandit, for that insight as well. Now, I want to ask you, Mr. Roy, just dovetailing from the above query, what is your advice for employees and customers before the third wave hits?
Our instruction to all the employees within the bank has all been to get vaccinated the moment your turn has come in. And almost about 90%, 95% of our population have got vaccinated. And about 35 to 40% have got double vaccinated themselves, including somebody like me, because our turn came in a little early. Thankfully, this is the only time we realize that being old is not such a bad thing. You're 45 plus, it's good. So you could get your turn a little earlier. The second is very clearly, as Dr. Pandit said, don't drop your guard. Don't be too paranoid, but don't drop your guard. So again, I feel that one of the reasons we had the kind of second wave we had is also because some of us as human beings, as individuals, as citizens of this country, we dropped our guard back. The moment we behave sometimes like some school kids, the moment there is ghanti, chutti ghanti nikalta hai, to sab bhagte ek saath, something like that kind of a thing. We don't get too paranoid, but at the same time, don't drop the guard. So he's already mentioned it. He's the expert that you need to continue to be masked even if you are double dose. The third is very, very critical. If you haven't yet bought your health insurance policy or your cover is not adequate, I completely agree with Dr. Pandit. And in fact, I was going to interject when Anand said that 10 lakhs. I think it depends a lot on what kind of lifestyle you live, what kind of incomes do you have. Because, for example, if a lot of our customers who have logged in today, they are yes Premier, yes First, yes private customers. Now, I don't expect and I don't imagine any of these customers of ours going to some roadside hospital, some one of those smaller nursing homes, and getting themselves treated. So they will go to a prestigious hospital like a Fortis or a Max, where you get the best of the doctors, best of the care, but that comes with a price. And hence it is important that you are not penny pinching when it comes to managing your health care. And for that, the best thing to do is to protect yourself adequately. I'll give you my example. I have taken a 50 lakhs cover for a family of 4. I have 2 kids, my wife and myself. I have a 50 lakhs family floater cover. At any point of time in a year, and I have taken it from Reliance because they are our partners. If I have to, if all 4 of us get hospitalized, till the amount of 50 lakhs, I don't think I'll need to shell out this amount. And for that, I pay a very nominal about 60,000 premium in a year. I think it's damn cheap from that perspective. You can look at it as an expense of 60,000, or you can look at it as an investment of 60,000, which can give you a 50 lakhs, up to 50 lakhs kind of thing. So a lot of us in India, as Indians, we have traditionally believed that we should only put in money in a product if I'm seeing the money back. We have not understood the power of protection products. When the event happens, the multiples that it throws back is significantly high. So it is important that you protect yourself as you get ready, or as you take care while moving to the third wave. And it doesn't matter, third wave, fourth wave, it doesn't matter if the pandemic ends. The point that I'm making is for forever. It's even after pandemic, you will have normal health issues, right? Pandemic se pehle bhi hum bimar padte hain. So it's important that these 3 things are taken.
Absolutely. Thank you so much, Mr. Roy. And rightly said that whether pandemic or not, health should come first, and you must protect your health through these products that are now easily available at bare minimal EMIs as well. So go ahead and check out which is the most effective one for you. But right now, because we have with us Mr. Singhi here, of course, we'd like to know from you, what are the features one should look at or keep in mind while purchasing health insurance? Now, there are many criteria, many different features. So which are the ones that one must keep in mind?
Okay, I think just before I kind of answer that one, to also kind of answer to Dr. Pandit and Mr. Roy, and just as a clarificatory point from my side, I think what I meant was a minimum of 10 lakh rupees per person. Typically in India, we end up having family policies, and the families range on an average, we see 3 people. So a husband, wife, and a kid is the bare minimum what we see through. So yeah, I think I completely agree that looking across that bit of mathematics, I think a 20 to 30 lakh rupee cover should kind of really suffice for the family. Only bit which I want to add now is that what has happened in the recent past, most of the insurance companies have come out with various set of products which also give you an autofill, which hence on an auto mode kind of really also takes care of you for double the sum insured. And like Mr. Roy, for the benefit of the audience, I myself have taken a 50 lakh rupee cover. Obviously, we share the same product, right, which we kind of manufactured in Reliance Insurance. Coming to the next point, Khatri, and that's, I think, is equally critical, that once you have decided what is the value of health insurance cover you want to buy, how should your health insurance policy look like? And this is where I want to bring an example, is that as a customer, a lot of times when we purchase policies, we kind of really start to look out for the cheapest one, or we start to look out for discounted sort of policies, right? My opinion, personal opinion, is that when we kind of really start to buy health insurance, what we should look across for, which should be for comprehensive protection, right? For any kind of things which can happen to you. Once we have paid the premiums, never ever we should think back that in case, God forbid, if we had to claim, what will be allowed and what will not be allowed. The insurance industry has gone through a huge amount of negative perception in the initial set of years of selling health insurance, is that when there is a claim, a lot of values don't get paid for. There are a lot of deductions. And that's where, as a customer, I think when we are purchasing the policy, it's critical to kind of really understand what the policy covers and what the policy doesn't cover. Our recommendation and the set of products which we have curated for our set of channel partners as well as customers is to ensure that we give a full-blown comprehensive protection, which fundamentally would mean that if you needed a hospital admission, you should not worry which room is available in the hospital and how you need to take a room. So there should not be any room capping at all. Second thing, which is again very critical, is that the product should not have any sublimits. Right. So if there is a COVID claim and if the COVID claim is going to hit you 10 lakh, it should not happen that the policy has got a sublimit of 1 lakh rupees or 2 lakh rupees, and that's the maximum value of claim which gets paid for. So one would always recommend that you have a full-blown comprehensive policy without any sublimits or deductibles. And the policy should take care of your treatment irrespective of the category of room which you choose across. I think once we have taken care of these set of things, we are fairly good for covering ourselves in case if there were hospitalization. Moving ahead, I mean, globally, if you were to look across, OPD is an equally big segment. Having said that, in the Indian market, we are still a little far off in terms of when OPD will also kind of structurally getting covered into the insurance segment. But there are products which are available where you can also seek some bit of OPD cover. So our recommendation would be that we have product which takes care of IPD as well as OPD. But as a bare minimum, what we should ensure is that we have got a comprehensive IPD cover. The comprehensive cover should take care of all your expenses in case, God forbid, if you needed to kind of really have a claim.
So well said, Mr. Singhi. And I think it should definitely clarify a lot of doubts from our viewers, because generally when buying an insurance, customers are flustered in terms of what are the key components, key features that we must look at. Right. So I'm hoping that this clarifies a lot of your doubts and gives you clarity on what are some of the main features that you must look at. It has to be a comprehensive product that you buy for yourself or for your family as well. Moving from here, I'd like to ask you, Mr. Roy, your objective has always been to build a successful customer franchise. How does health insurance and the partnership with Reliance General Insurance work towards this particular plan?
Kathy, just to add on to the point that Anand was making and the point that you made about availability of plethora of choices and then deciding which one to kind of pinpoint and which one to decide this for yourself. All the customers who are here today and hopefully we'll be able to propagate this further, they should contact their respective Yes Bank RM because they have all got an RM assigned. The training, the theme that we have propagated and we have built at Yes Bank, which is something that we really believe in for all our customers, is a theme called Protect and Prosper. We believe that you need to be looking at prospering and you need to look at protection. And I'm talking purely from a financial well-being perspective as a bank. And it's important that the customers understand that there are, and within the protection umbrella, we call it, and this is a theme that again we conceptualized, called 360-degree protection, which means that every customer has to look at a bare minimum 4 kinds of protection. Right. One, very clearly look at something which is protecting your life as in a term plan, because God forbid something wrong happens, and it can happen, and the pandemic has told us that there is no age right age to die. There is no right age to survive, right? So it is important that you are covered adequately, because a family provider, our responsibility is to ensure that our family does not get compromised financially. Emotionally, we can never fill up, but financially, they don't get compromised in case something happens. That's first. Second is definitely look at a plan and a combination of plans on saving side, which meets all your long-term goals. Okay, which is our bunch of life insurance savings plan, whether it is par, non-par, ULIP, etc. So, and it is a little vast subject. All our RMs are trained on it, and our customers can reach out and understand the set of products that we have. And based on the risk appetite, based on the goal, based on the quantum that is required for the goal, you can get your respective plan. The third is protect everything that you already have accumulated, which means that all the assets. Now, let's say we have a flat, we have a piece of, we have furniture, we have content in our home, we have a shop, or we are running a restaurant. Different customers have different kinds of assets, and just let's put the physical assets. Please ensure that the physical assets are protected, because this is a hard-earned saving. So in India, a lot of us ignore the asset protection.
Right.
You just see it, the fact of the matter is that there are natural and unnatural hazards that happen, and your asset can get badly damaged in case it is not protected. And if it is protected, then at least the damage is paid for by the insurance. Asset protection is the very important thing.
Right.
Fourth, the topic that we have been talking about today is about health insurance. And along with Reliance General Insurance, we have built a fabulous health insurance franchise already. And the product that Anand was talking about, and I'm also a customer of, is called Reliance Infinity. It's one of the premium health insurance product, typically suited and brought out all those points that Anand made about no sublimits, good high sum assured, very comprehensive plan, ensuring that your pre and post hospitalization is paid for. All of that is covered, no room rent capping. All of that are features that we have co-created along with our partner Reliance for this segment of customers who are listening to. These are our HNI, super HNI customers who believe in giving their best to their families when it comes to healthcare, when it comes to their lifestyle. And hence that product is definitely curated for them. So my request to all our customers who are there is to reach out to their RMs, and we'll definitely ensure that the RMs reach out to them, but you reach out proactively and ask for this Infinity as a product so that you even, and there is no right day to buy it. No right day to protect yourself is today. It can't be tomorrow.
Absolutely.
Because tomorrow may be something that you have not planned for. So it's important that you do it today, and along with Reliance, and I'm thankful for the partnership and the support that the Reliance team gives us. We have been able to cover almost 4.5 lakh customers on the health insurance bit over the last 3 to 4 years of project. So all those customers, and we believe that every customer we cover actually gives us the blessing. So we have saved so many blessings over the last 4 or 5 years, which is helping us prosper ourselves as a bank and as a partnership.
Wonderfully said. Thank you, Mr. Roy. And yes, we can see this collaborative effort that, Yes Bank, knowing its customers very well, in-depth knowledge of who their customers are, what are they like, their lifestyles, and bringing in an expert in insurance. Right now, talking about health insurance, a company like Reliance that, puts all the expertise together and brings out a customized product. So I think this is a great opportunity. And like Mr. Roy said, there is no better day to insure yourself, get yourselves protected than today. So on that note, I'm going to take this question to Mr. Singhi, because like we said, it's a collaborative experience. So what has been, Reliance General Insurance experience, and what do they want to leave in the minds of the customer? What is that experience?
So, Gati, I think very critically for Reliance General Insurance, I think Yes Bank is a very critical partnership which we have. And I think in the partnership, we all have grown together, understanding our customers well, understanding the segments of customers, understanding what are their lifestyle choices, and kind of really curate products which kind of really take care of those sort of needs. From an experience perspective, if there is one word which I want to use across, I think that's a common philosophy for Yes Bank and Reliance General Insurance, that the word is wow. We want to leave a wow experience. And to that extent, when with Mr. Roy, we were kind of really debating on building the entire franchise, he was very clear that how do we kind of really get this wow experience reaching to our end set of customers. That's where we decided on the concept of health and wellness coach. And we said that we will kind of really co-share and co-own this responsibility, where from the bank side, all the relationship managers become the health and wellness coach at the point of customers wanting to buy the policy. And from the insurance company side, we become the health and wellness coach if in case there was a requirement to be able to take care of any bit of claim. So what we wanted to ensure is that we give a wow experience. And towards that, a few of the things which we have done, and that's something I should highlight, is that the entire buying experience have been digitally managed. The entire claims experience can be digitally managed, but we have also ensured that there is a human face, there is a human touch at every given point of time. So when a customer is wanting to buy a policy, there is someone who explains him that what he should do, and somebody kind of really says that what sum insured, what coverages you should choose. Once decided, the transaction then gets managed completely digitally. Similarly, at the point of claims, I think the customers can significantly kind of intimate a claim online on a mobile app or on the call center or through an email. And the moment that gets done, our health coaches will kind of get connected with the customer, will get connected with our providers and ensure that we provide a seamless experience for the customer while he's there in the hospital and take care of all bit in terms of his treatment necessities, right? So I think that's something which we've been kind of really very strategically and very clearly following across the life cycle. Alongside, what we have also believed is that people also don't want to be intruded significantly, and hence as much as you can digitally notify, I think that would be significantly helpful for customers. So across the life cycle, both on the buying side as well as on the claim side of it, we have necessary notifications getting pushed to the customers where they are kept abreast in terms of various developments, in terms of their policy transactions, or in terms of their claims transactions and how it is kind of really progressing ahead. So I think that's something which we have co-curated. And I think we just attempt to live to that bit of promise of really bringing the wow experience every single day.
Absolutely. So wow is the experience that we want to create for our customers here. But right now, our customers want to know more, because here they have sent us their questions to us. So I want to ask any of you who would still like to go ahead and ask some questions to our experts on the screen. As you see, we have a well-renowned doctor who's working with the COVID task force. We have two experts from the bank and the insurance. You know them well. They are well-known names in the industry. So if you have any questions, go ahead and put it in the Q&A tab. Send us your location from where you're asking this question so that we can address it better. So I want to go ahead and ask this first question to you, Dr. Pandit, because of course we're talking about COVID. So health is at the center of everything. We have Shantanu Ranjan Tripathi from Jaipur, who is asking, what are the precautions post-COVID patients should follow? And is there any specific diet, any meditation, or any other form of things that you would kind of suggest at this juncture?
Very, very important question, Kathy. I think I would like to suggest my gentleman here with us the question to do a daily 4 hours of digital detox. When you come out of COVID, the last thing you want is to read another message on the WhatsApp about COVID, or to open up the news channel and see how many cases were positive and how many deaths happened and so on and so forth. What I actually prescribe on a prescription pad every time a patient is coming to me on a follow-up is 4 hours of digital detox. At least 2 hours in the morning, 2 hours in the evening. Specifically, a couple of hours before you actually decide to go to bed, you should be away from all of these things. And I think that plays a lot on your mental health, your mental well-being. In terms of your overall physical rehabilitation, it obviously depends on how severe COVID you had. If you had a mild or asymptomatic COVID, a normal daily routine should be back pretty much very quickly. It shouldn't take time. But if you were unfortunate one to be hospitalized, or even unfortunate to be admitted in the ICU and you're coming out of it, then you need some pulmonary rehabilitation. You need some physical rehabilitation with the physiotherapist, with the pulmonary physiotherapist. You also probably need to build up your exercise endurance. So I typically ask them that once their oxygen saturations are okay, their heart rate is a bit stable, I ask them to start walking 5 minutes every day. increase the capacity to around 30 minutes by the end of a month or so by walking, if they are able to walk. If they are elderly, I ask them to start walking around the home within the confines of their home under some supervision with somebody around in the house. And again, I just ask them to increase the daily walking within the confines of their home till they are comfortable enough to step out of the house.
Right.
Meditation helps. A good, nutritious, balanced diet is what you need. You don't require any specific diet to come out of COVID. The best is to ask your mom to cook for yourself, and you'll be fine. Most of us will be fine because mom knows what needs to be given in a balanced way. You don't need to actually invent a very good cook or a dietitian or anybody. Just ask your mom or grandmom, and they will tell you what is right to eat, and just do that.
Thank you. Thank you, Dr. Pandit. Very well said. And I would like to, kind of just highlight a point here that what you also mentioned, that we have so much exposure to information currently, right? We have fake news, good news, bad news, WhatsApp news, all of this coming to you, bombarding you with so much information, but you don't know how to segregate or filter it and find the right kind of information. So thank you for saying that. I hope all our viewers are watching. Do not fall under the pretext of new COVID superfoods. Mom knows best. Listen to her. So on a lighter note here, I would like to now move towards our next question. What can we expect? When can we expect vaccination for children? And what, according to you, are the risks? This question is from Chaitra Bhatt.
So, Chaitra, the vaccination trials for children are underway. And from what I know, and this is not a first-hand information, unfortunately, this is the via information. The trials are probably going to be going on until September or October, and then they would then they would probably analyze the results and apply for the permissions. So I see that the vaccination for children may take around 2 to 3 months before it's available for them. That's the quickest I can say. And these are the Indian companies, the Covaxin trial, which I'm talking about. The abroad, there is a Pfizer trial which is happening, and that Pfizer trial may take some time before it actually gets the permission in UK and US. And as we know, even the adult Pfizer vaccine has not come through. So the pediatric vaccine may take some time for it to come.
Right. Thank you so much, Dr. Pandit. Dr. Pandit, you've already mentioned about this, but if you'd like to reiterate, we have a question from Pankaj Jain. He says, any new SOPs except the current ones to prevent ourselves from the third wave?
So the third wave, I think the SOPs are very simple. They are not different than what we have been doing in terms of the first wave and the second wave. The epidemiological principles remain the same. Masking, social distancing, and essentially keeping your hands clean. And the fourth one, which has been attached since January 2021, is the vaccination. If we adhere to these four, you don't require anything else, absolutely nothing. And out of these four, if I say which are the two most important ones, masking is most important. When you're stepping out of the house, double masking. Do not remove your mask unless and until you are alone. And the second one is vaccine. Take the vaccine when your turn comes for vaccination. Do not wait for a particular vaccine. Do not insist that I need to be having this type of vaccine, that type of vaccine. All vaccines are good.
Right. So, Dr. Pandit, another question for you again, because this is about the symptoms of COVID. Now, Akhilesh Singh asks, what are the main signs of COVID? As most of the time, cold, cough, body pain, headache, shoulder pain in sales guys is common. I'm guessing that's what he meant. Then how to judge for the same? How do we judge if it is COVID symptom?
Yeah, no, I think that's a very important question. See, the COVID is a infection which is a viral infection. So you would get symptoms which we call in medical terminology as constitutional symptoms of any viral infection. And typically they are fever, cough, cold, body ache, joint pains. You may have some GI disturbances, sometimes nausea. But these could be done with, these could be symptoms which would be seen with other viruses as well. For example, H1N1, influenza, para-influenza, so on and so forth. So our duty again is that if you have a symptom which you feel is a viral symptom, first and foremost, isolate yourself from everybody else in the home, wear a mask, and consult your doctor. Don't be your own doctor. Do not believe on WhatsApp and Google universities. They will throw you diagnoses which are so difficult to pronounce. Even I find it difficult at times to understand where did this come from. So best is to consult your doctor and they will be able to give you a good answer for that.
Perfect. Our last question here from our audience, Abhishek. He says, should we look beyond the third wave as virus seems to be mutating and throwing up new variants? Would like to know more about the post-COVID side effects.
Yeah, so there would be cycles. There would be a third wave, fourth wave, fifth wave. I don't know how many waves. Nobody knows that. And we have to be prepared for it. But we have to remember to live with the virus right now for at least the near future. There is no way that the virus is going to just disappear one fine day when we get up. So it's going to be a process which is going to take time. I think unless and until the entire population of the world gets vaccinated, eligible population gets vaccinated at least once, we will not be sure whether the virus is going to become endemic or not. Post-COVID complications are numerous. Fatigue is the most commonest complication with which people have, and that fatigue sort of manifests in different ways for people. Sometimes even an hour of work is very difficult. Sometimes 4 or 5 hours of work and you feel you've worked for the entire day already. Then there are other symptoms which I mentioned: sleep disturbances, bowel disturbances, appetite loss, weight loss, hair fall. There are subtle signs which are there. And all of them basically are a part of a post-viral syndrome or a post-COVID syndrome. So please seek the help of your doctor. He will be able to judge and understand whether that symptom needs treatment or it just needs some time to go by and it will all come back and settle down again. Don't be your doctor. Again, and again, I would like to emphasize, neither the insurance companies, neither the banks want you to be your own doctor. Please seek your doctor's opinion. Your family doctor is more than enough. You don't require a specialist for it. Just go to a family doctor. They'll be able to guide you. They'll be able to tell you when to seek a specialist help.
Absolutely. Thank you so much, Dr. Pandit, for emphasizing on this point that do not be your own doctor. These are not the times to rely on Google and other sources. Visit a professional, go to your family doctor, consult him or her, and then take steps forward. Before I let all of you go, I'd like to ask you if you'd like to leave our audiences with few words, because right now we're talking about health matters. So your few points, closing, points to our audience. Mr. Sanjeev Roy, starting with you.
Health is wealth, protect and prosper. It's important for all of us to imbibe these two philosophies in life. Ensure that you are taking good care of it, and you also are taking a good enough cover to ensure that if something goes wrong, your family does not face the problem. So, health is wealth, and protect and prosper.
So articulately said. Thank you so much, Mr. Roy. Mr. Singhi?
Yeah, I think I completely agree with what Mr. Roy said. That the only thing which I want to add to that is get yourself vaccinated as fast as possible. And as a small gesture from Reliance Insurance for all people who have got vaccinated at the point of their policy's renewal, or if they are buying a new policy, there is a small incentive in terms of discount which we are giving on the existing policy premiums. So yeah, I think get yourself vaccinated and also take the benefit on your health insurance policy.
Wow, that's a double whammy there, right there. Thank you, Mr. Singhi. So all those who have already got vaccinated or are getting vaccinated and going to buy a policy, remember you can benefit because you're vaccinated with this additional discount from Reliance General Insurance. Great news. Dr. Pandit, some last words to all our viewers.
So my words would be that learn to live with the virus. Do not get paranoid about the virus. Virus is going to stay for some time. We have to learn to live our life along with it. Wear a mask, get yourself vaccinated. As far as possible, avoid crowded places. But if you have to go, then wear a double mask and do not remove your mask in the place out there. The second thing, which is most important, is that even after your turn comes for vaccination and you do get vaccinated, do not leave the COVID appropriate behavior. Continue to mask yourself. You are there to protect yourself and your family. So do not sort of be complacent about it. And I really like the little gesture of the Reliance Insurance, which Mr. Anand Singhi just mentioned, that they have got some incentive for vaccinated people. I think these are the incentives which are very, very necessary in the world. And people need to come out with such kind of, it may cost only a few rupees to the organization, but that incentive actually is a big motivation for people to get vaccinated. Right now, the vaccine hesitancy, along with the lack of availability of vaccine, are the two problems which you are facing. At least the hesitancy can be taken care of. The vaccine production is actually a real problem. It's 7 billion people in the world, 7 billion plus, out of which 1 billion plus are staying with us. So it is going to be a bit of a problem before we can produce that many doses into two, because we've got to give 2 doses to everyone. So
Right.
I think we just need to be very clear for the government as well that government is doing a good job. They are not sitting there and just watching. They are actually working very hard to get that many doses. But just imagine the number of doses they require: 100 crores into two, around 200, 190, 200. That's what the figure is coming at, 1 crore in crores. So give them some benefit of doubt. They're actually working very hard to get these vaccines, and whenever they come and they are been offered to you, don't be sort of doubtful about it and say that I would not take it right now. Please go ahead and take it. That's the only way to save the world.
Such amazing words to end this discussion on. Thank you, Dr. Pandit. That is the only way to save the world, ladies and gentlemen. Trust the authorities, trust the trusted names in the industry that are working really hard so that you are protected. Thank you so much, gentlemen, for your time and being here, sharing your insights and knowledge with all of us. Thank you so very much. Mr. Singhi, Mr. Roy, Dr. Pandit, this session has truly been very insightful. I would now like to thank all of
And
you.
compliments to you, Khyati, for coordinating it so well. So well done.
Thank you. Thank you, Mr.
Well
Roy.
done, Khyati. Well done, Khyati.
Thank you so much.
Thank you.
Thank you.
Ladies and gentlemen, I'm sure that all of you have also benefited immensely from the knowledge that has been shared here. Once again, I take this opportunity to thank Mr. Sanjeev Roy and Mr. Anand Singh for taking out time and imparting the importance of health insurance with all of us. Most importantly, I would like to thank you, our lovely audience, for joining us for this webinar this evening. From all that we have heard today, it is evident that during such unpredictable times, it is imperative that we all take corrective steps during the pandemic and be safe and healthy. Also opt for a comprehensive health insurance for all medical emergencies. With that, I thank you all once again. Stay safe, stay healthy, stay protected. This is me, Khyati Kawai, who's signing off. Have a very good evening, everyone.